Hey Andy, how's it
Hello,
going?
hello. How are you?
Great, come on in.
Yeah, are you ready for your 73 questions?
I am.
Oh man, great enthusiasm today.
Thanks.
So let's get started. What is your name?
Come on in. My name is Rahul Damania.
And what is your specialty?
Pediatric critical care.
Awesome. And what year are you?
PGY 6, last year of fellowship.
Getting close to the end.
Oh, can't wait.
So where did you go to undergrad?
Youngstown State University. Go Gwins.
And medical school?
Northeast Ohio Medical University, also known as NeoMed.
Okay. Now, did you take any gap years before going to med school?
I didn't. I actually had a unique path. I ended up doing an accelerated 6-year BSMD program.
Huh, that sounds a little familiar to me. But I know it's been a bit, but what was your favorite part of medical school?
Honestly, I just loved the camaraderie. It was such a stressful time, but I made the best of friends.
I think that's a pretty common theme across everyone.
Yeah.
So, what specialty did you think you were going to go into on your first day of med school?
Probably pediatric surgery.
Really?
Yeah.
Now, what changed your mind about that specialty?
Honestly, I just love working with kids, and I knew that I would have a long portion of my life to work with adults prior to actually working with kids.
Okay. So, were there any specialties you immediately said, absolutely not for me?
Probably OBGYN. I have great respect for OBs, but honestly, I don't think it's for me.
I think that's pretty common across a lot of people.
Yeah.
So, going back to what you do specialize in, what first made you fall in love with pediatric critical care?
Oh, this is a great question. Honestly, when I was a second year medical student, my sister ended up getting pretty ill, and it was such a formidable experience for me and really shaped my career.
Okay. Now, for those wanting to be in your shoes one day, how long does your training take after med school?
So you have to do 3 years of general pediatrics residency, followed by 3 years of pediatric critical care fellowship.
Okay. Now, did you ever consider getting other degrees like an MBA or an MPH at all?
I haven't, but I actually just started my master's in medical education.
Ah, that's a new one. I haven't even considered asking that.
I'm actually super excited for it.
That's awesome. Now, what would you say is the most unique part of your specialty?
I think it has such great roots in pathophysiology and also connecting with families.
I see that. Now, I always love this question because I give everyone a chance to sell their specialty like a car salesman. So why should someone choose pediatric critical care?
Ooh, this is a good one. Well, honestly, if you enjoy challenge, a mental challenge, you enjoy procedures, you enjoy connecting with family, taking care of very sick children, and collaborating with many specialties, I'm telling you, pediatric critical care is the best field out there.
Well, now kind of a devil's advocate, why should someone not do pediatric critical care?
Honestly, pediatric critical care, it has its challenges, definitely not one of those lifestyle specialties, but what I will say is that when you're on, and when you're off, honestly, you can have other extra clinical activities.
Yeah. So, what would you say are some of the stereotypes of your field?
I think intensivists in general are known as intense people. We like things somewhat in order, but there's also a fun, relaxing side because we do deal with a lot of stress day to day.
Well, next question would be, are any of those stereotypes true at all?
I think some of them are, but in general, I do like working with intensivists and other subspecialties. So maybe there is a little grain of truth.
Gotcha. Now, you're still a fellow, and even though you're almost an attending, you're not quite there yet. So, what is the craziest question you have ever been asked by an attending?
Honestly, I had a patient one time who had a horse accident, and one of my attendings asked me, "What was the name of the horse?" That threw me off guard.
Why is that clinically relevant?
I don't know, but it really stresses the importance of taking a good social history, I guess.
Okay. All right, I'll remember that.
Yeah.
So you work at Emory, so I'm sure you interact with a ton of medical students.
Yes.
So what is your go-to question to ask the medical students on the wards?
Ooh, that is a great one. Honestly, I love questions related to physiology. So I'll be talking a lot about shock and oxygen delivery. And I ask students the equation for oxygen delivery.
All right, I'm going to move on before you ask me.
Kind of nerdy, I know.
That's not bad. Oh, what does an average day for you look like?
Well, it depends if I'm on service or if I'm on nights or if I'm on a research week. Typically, when I'm on service, I'm typically up by 4:30 a.m. just trying to look at patient charts. We round by 7, and you end up finishing your day sometime in the early evening around 6 o'clock after handoff. Call days are a little bit intense. Sometimes we're in the hospital for 24 or even 28 hours. But it's the people who are at work that really help me get through it, as well as sometimes, I hate to admit it, the cafeteria food.
Oh gosh. Okay. Well, you know what? I have a question for you later.
Yeah.
But kind of getting back to your busy schedule, how many patients do you see on an average day?
Well, we have a 36-bed ICU, and we divide it up amongst teams. The maximum that we end up seeing and rounding on is about 18.
What is the most amount of patients you've ever seen in a day?
Ooh. Well, on nights, we're taking care of all 36 patients, but we do have a nice team-based approach to our care.
Okay. And now you work in critical care.
I do.
Which means that things can get a little crazy.
Yes.
So what is the scariest critical care situation you've encountered?
That's a really good question. Honestly, I've had children who have had really traumatic liver lacerations, and they end up losing a lot of blood very quickly. And those are the most challenging cases because you're trying to balance their shock, and we are trying to deliver oxygen by giving them a lot of blood.
So kind of flip it around on a more positive note. What is the most memorable patient encounter you've ever had in the ICU?
Can't think of a specific one, but I will tell you that children have such great physiologic reserve, and honestly, the children who surprise me the most are the children who have some sort of traumatic brain injury, and just through some great principles of neurocritical care as well as great rehab, those children end up bouncing back and have relatively good functional status, and those are the most memorable.
Children are incredible, aren't they?
Yeah, they are, really.
No. Now, what is the toughest part of your job in your opinion?
The toughest portion, honestly, it is talking to families about end-of-life decisions for their children.
God, those can't be easy conversations.
Yeah, they really require a team effort, and I frequently am debriefing with my colleagues and whatnot because it can be such an emotionally charged experience.
I'm sure. Now, to put it on a lighter note, what is the most rewarding part of your job in your opinion?
Honestly, the most rewarding part of my job is to take care of very sick and critical and complex patients and give a little bit of hope and also guide families through such a difficult time in both the child's life as well as the family's life. It is absolutely so rewarding. Sometimes words don't even express how rewarding it is.
That's very well said.
Yeah. Well, hey, Andy, it's a nice day outside in Georgia. Want to take a walk?
Sure.
All right.
Let's go. Oh, you're right. Beautiful day outside.
Yeah, it's kind of hot for Hotlanta, but...
Absolutely. But let's continue with some of the questions.
Sure.
I got some kind of quick fire ones about your lifestyle to go through. So how many hours do you work in an average week?
I would say around 80 to 90 hours.
Woo. Yeah, resident fellow life, right?
Yeah.
What time do you normally wake up?
Usually around 4:30 or 5, but I'm an early bird.
What time do you normally leave the hospital?
Around 6:30.
How many hours of sleep are you typically working on?
I try to get 7.
How many hours of sleep are you working on right now?
more towards 8. I do really appreciate a good night's rest.
Now, you mentioned it earlier, but do you have to take call?
We do. Usually, our call is considered either a night shift, which is about 14 hours, or we do 24 to 28.
Are you a night or day shift kind of person?
Oh, definitely day shift kind of person.
I know people who prefer both.
Yeah.
So, how long does it take you to chart?
Well, it depends. Sometimes there are some pre-populated templates, but on average for a new patient, depending on complexity, I would say it takes a good 15 to 20 minutes to make sure everything's accurate.
Okay. Wholesome question. Who are you most thankful for on your care team?
That's a tough one. I honestly feel like everybody has a equal share. Everyone from the EVS workers who come and help with cleaning the room, all the way to the bedside nurse and the APP team, as well as my attending who make sure that everything is running smoothly.
Of course. Now, what is the craziest thing you've seen in a patient chart, without violating HIPAA?
Yeah, honestly, I feel like the craziest thing has been sometimes those social situations where there are multiple family members and it's hard to keep track of who all has been visiting the patient.
Now, what is the most common medical advice you give to your patients?
Well, one of the common medical things that I do say, that I say half-heartedly, jokingly, is that I hope I don't see you again, because I'm the pediatrician who you probably don't want to see on a recurring basis.
That's a good piece of advice.
Yeah.
Now, this is a really good question, and one of my favorites I ask, particularly pediatric physicians. What is the one lesson a child taught you that you did not expect to be taught?
That is a really good question, Andy. Honestly, children have taught me to be very forgiving. There are a lot of bells and whistles and sometimes pokes to children, but when you're able to connect with a child by just simply playing with them, honestly, I really believe that children are the most innocent members of society, and they forgive you very quickly.
Pretty well said. Now, we've talked a lot about your life inside the hospital, so how about your life when you clock out? So, what is your favorite thing to do when you are not working?
Honestly, it is hanging out with my friends and family. I do a lot of traveling as well.
Okay. Do you have any significant other, kids of your own?
I do. I have my fiance. We're going to be getting married in a couple months. She's an OB resident.
Wow, congratulations.
Oh, thank you. I appreciate it. A lot of wedding planning.
Now, does your family ever ask you random medical advice, or for random medical advice?
They do. However, I'm not an adult provider, so hopefully I can tailor them to be a little bit more pediatric oriented.
So, what is the weirdest question a family or friend has ever asked you?
I get a lot of questions about diabetes and hypertension medications, and honestly, that's something that I don't see as often, and they can be sometimes a little bit more uncomfortable for me.
Yeah. Any pets?
No pets.
Favorite animal, not a dog or cat?
I would say goldfish. They're pretty to look at.
First time anyone said a goldfish. Okay. If you could have dinner with anyone in history, who would it be?
Elon Musk.
And what would you guys be eating at that dinner?
Well, I feel like he ends up having a lot of interesting stories. He has had some ups and downs in his social lives as well, and I'd just love to hear his thoughts on how he balances so much.
All right. So, what's your favorite dish to eat?
I'm a sucker for pizza.
Ooh, all right, follow-up question, the most controversial one. Pineapple on pizza, yes or no?
No, I just can't handle the tart and the sweetness.
Okay. Coffee, tea, or soda?
I would say coffee.
And how much water should you be drinking every day? Coming from a Pete's Crit Care doc.
Honestly, it should be proportional to every cup of coffee I drink, but I am working on that. Hopefully one of these days I'll hit the 1 gallon challenge.
Gotcha. All right, you mentioned this earlier, hospital cafeteria food keeps you alive. What is your favorite thing from the hospital cafeteria?
Well, I usually try to default for salad, but man, sometimes the mac and cheese just takes me back to the elementary school days.
Ooh, any artistic hobbies you keep up with?
I do like to play the Indian drums known as the tabla, and I actually am a vocalist for Bollywood performances. In my spare time, I like to sing at weddings.
Hidden talents all around. So, favorite movie or TV show?
Ah, man. I am just always on YouTube, so it's tough for me to isolate a favorite movie or TV show. I did like Taken, which was a movie that is pretty popular, a lot of suspense and whatnot, but I do also hang out on YouTube and watch your videos.
Oh, thank you. So, top 3 music artists.
Ooh, a lot of them are Bollywood oriented, but I like Arijit Singh. Usher is a classic, and some of those feel-good Maroon 5 videos and music songs I really like.
Favorite song at the moment?
Favorite song at the moment? That's a tough one. There are too many to choose.
Oh, come on.
That one.
First one that comes to your mind.
Well, first one that comes to my mind probably is one of these Indian ones, Kal Ho Na Ho, which has a really nice meaning, which means live every single day with utmost gratitude and potential.
That was a much deeper
Yeah.
answer to that question.
I know. I
was
need to
expecting.
start like listening to some mainstream music, but
No, it's all
I think
good.
I'm a
Listen
weird
to your
guy,
own
I guess.
music. Not at all. So, what is one random task you wish you could be better at?
Ooh. Honestly, I wish I could be better at probably. Ooh, that's a tough one. I wish I could be better at cooking. I think I have some room to grow in that realm.
Sure.
These are tough questions, Andy.
Oh, come on. They're not giving you too much trouble. So, night in or go out on the town kind of person?
Go out of the town.
Indoors or outdoors?
Indoors.
Beach or mountains?
Beach.
Would you consider yourself more of an introvert or extrovert?
I would say extrovert.
And was that personality trait a factor in you choosing your specialty?
It really was because we end up communicating with a lot of different pediatric subspecialties. So I do feel like when it comes to the personality traits, being an extrovert sometimes ends up being a favorable attribute.
Gotcha. All right, so we're getting close to the end.
Okay.
No, but these last few questions are going to be the more intense, reflective ones. So are you ready?
All right, let's do it.
First one. What did you think you were going to be when you grew up as a kid?
I thought I was going to be a scientist or a professional tennis player, but I have a family that are all in the medical field, and that really drove me to pursue medicine at a very early age.
Is there a different specialty you think you could have done?
I always center myself around that question, but I feel like pediatric critical care was just such a great fit. I really like to work with my hands, and I thought that that was only going to be gated to a surgical subspecialty. But what I quickly found out was that pediatric critical care, you end up doing procedures, intubations, central lines, arterial lines, putting in dialysis catheters, and I think those quick procedures give me that fix of working with my hands and helping children in need.
Now, if you didn't do medicine, what do you think you'd be doing right now?
I'd probably be a preschool teacher, just because I really like working with kids, and I love seeing their face when they learn something new. It keeps me young internally as well.
Great answer. All right, so everyone that's been through the medical field, no matter if you're a doctor, nurse, PA, whatever, knows that it's not an easy road there. So were there any times that you that you doubted that you would make it as a doctor?
Definitely. I do think that sometimes when you feel like you're alone and you're just studying and you may not see the long-term context, it's very easy to get down a little bit on yourself and question yourself whether you can make it or not. I think that this is also coupled with when you have a lot of competition or a lot of peers who are trying to achieve similar aspirations as you, and that can sometimes change your thought process to more of competitiveness rather than the true sense, which is entering the medical profession and making sure you can have an impact in research as well as especially at the bedside. But I do think that when I switched my thought process to focusing more on the journey rather than the outcome, I realized that whichever outcome it was, whether it's matching or even finding an attending position, the outcome is always beautiful at the end, especially when you keep an optimistic and positive attitude. A little bit of a cliche answer, but this is truly how I feel.
Yeah, it's the truth. So if you could change one thing about the medical field right now, what would it be?
I do think that the medical education strata and how medicine is taught in medical schools has some room for improvement. I think that there is a push for more active learning, which is great, but I do think that there is a signal to combine technology and education together, and that's an area that I'm also particularly very interested in.
Yeah. So what can a medical student do right now to go into pediatric critical care?
Absolutely. I think honestly, it's a combination of making sure that you stick with the process. Obviously, there are certain steps, no pun intended, that you need to clear in order to apply for residency and then subsequently fellowship. Garnering mentors and having some internal soul searching into whether or not a pediatric population is a population you want to dedicate your life to. I think those are good first steps.
Now, if you were to go back, would you change any of your experiences that got you to where you are right now?
I don't think so. I'm really happy as to how my overall training and trajectory has panned out. So very grateful for the process and where I've come to. Honestly, reflecting on it, it's probably more of an effort of all my mentors, family, and friends who supported me through this, because truly when you go through medicine, it takes a village to make sure that you come out well on the other side, but the journey is so worth it.
Yeah, I don't know a single person that's said anything but no to that question, which then leads me to the last and final question, 73.
All right, hit me, Andy.
What would you say to the aspiring peds crit care physician right now?
I would say that pediatric critical care is one of the most rewarding fields in medicine. You get to combine your passion for science, what probably got you into medicine, the passion for pathophysiology, and you get to combine it with humanism in medicine, which is amazing. You get to connect with families, guide them through difficult decisions, and children end up becoming so resilient that you end up having so much fulfillment as you see a child go through their illness state and hopefully get better.
Really, really well said. I mean, your passion truly shows throughout this entire interview. So thank you so much for your time, Rahul.
Andy, thanks for spending the day with me.